1.7 million Americans each year contract a hospital-acquired
their immunity for the highly contagious measles virus after
bacteria that are much more common in the hospital.
Exercise precautions. You wear your.
I'm Tia. I'm Sarah.
I'm Nikita.
And we're the team behind the Cure-Tain.
The Cure-Tain is a specially formulated air filtration partition designed to catch harmful microorganisms in the air. And F1 filter fabrics are the main components of this accordion-style filtration device. The main purpose of this divider, which is placed in hospital wards, is to keep outside bacteria from infecting patients and from keeping bacteria from patients infecting staff and visitors.
The Cure-Tain will thrive best in the medical industry, implemented in hospitals and medical facilities. We understand that a fabric will not be as useful on its own, so we suggest that it is used in conjunction or as a last resort. It is especially useful in low socioeconomic areas where money is slow, and therefore will not be viable as a proper solution. Cure-Tain is a unique product that basis is not widely known, but will create the need for similar products on the market. Our product is affordable, it is a viable preventative measure.
The air inhaled by people in hospitals, especially visitors, is abundantly populated with microorganisms, also known as bioaerosols. Bioaerosols are particles formed by liquid droplets and particles of solid matter in the air, whose components contain viruses, fungal spores, bacterial endospores, plant pollen, and fragments of plant tissues. These bioaerosols are the foundation for many infections. Healthcare-associated infections, or HAIs, kill more people in this country than AIDS, breast cancer, and auto accidents combined. Also known as nosocomial infections, they are transmitted by a variety of vectors, including person-to-person, through injection or insertion of medical devices, airborne contact of open wounds, and by respiration of airborne particles. Some emerging diseases, such as Middle East Respiratory Syndrome, or MERS, are not yet understood well enough to positively identify the transmission vector. The most dangerous HAI pathogens are those that have the potential to spread by the airborne route. Most of these pathogens, such as MRSA, are now called superbugs because they are virtually invincible to standard drug treatments. Favorable indoor environments tend to self-perpetuate these agents, adding to the concern by infection control specialists everywhere. Many HAIs are preventable, but the lack of proper sanitation and filtration is what makes them so prevalent.
Our product is specially developed for the medical market to ultimately make it a better, safer environment. Within the medical sector, our versatile product is suitable for small medical practices to large hospitals. Due to the properties of the accordion-style door filter, it is most effective among places like hospitals to catch microparticles. Within these medical areas, our product's purpose can be utilized to its full potential. Hospitals and doctors' offices are generally illness-plagued areas with airborne disease and bacteria rampant. The Cure-Tain, due to its versatility, can be used in facilities by doctors and patients easily, from separating hospital beds, used as dividers in doctors' offices, to being used in.
The Conrad air purifying curtain by IKEA boasts a textile that breaks down common indoor air pollutants, such as odors and formaldehyde. When activated by light, both indoor and outdoor light, Conrad breaks down common indoor air pollutants. The Cure-Tain aims to do this more efficiently, activated if a steady airflow is present. Moreover, our curtain uses multiple layers of F8 filter material, a rigid filter material optimized for multiple uses in medical practices and hospitals, which is the secret to the Cure-Tain's efficiency. The Cure-Tain, unlike the Conrad, breaks down the actual bacterial endospores and particles that cause the spread of airborne disease. The material filters out particles of less than 1 micrometer. Moreover, its 99.9% arrestance rate means that it is able to filter a great number of particles. Its curtain design also means that it has an essence of simplicity. The HEPA filter is made of a complex formulation of circuits and moving parts, while the Cure-Tain is a simple woven fabric design with a rod.
The Cure-Tain is an accordion-style door, but its extensive range of uses and practicality that make it an innovation are sure to make it a pioneer in the medical industry. Its original intent was to reduce the prevalence of HAI-causing bacteria in hospital wards. Our product utilizes a simple design with enhanced features to bring consumers an ergonomically designed, bacteria-fighting innovation that can be used in hospitals, private healthcare facilities, and other medical facilities.
Cure-Tain, the way, the truth, the cure.